Okay, so this video will be the introduction to some core stability, and we'll also review C-section scar mobility for early postpartum. So these exercises are safe, completely safe to do once your scar incision site is healed, and as long as you have no generalized pain in the abdominal region. Most people say to wait 6 weeks. I say to start this as soon as you feel like you're ready to. So first one, you're gonna grab a little ball, pillow, towel, block, whatever you have. You're gonna lay down. I like to still keep a pillow to just kind of rest your neck. Between holding a baby and nursing, it could be a lot on our shoulders, so this is just like a nice way to give yourself some TLC. You're gonna place the ball between your knees. As you inhale, you're thinking of your ribs expanding in that 360-degree way. So forward, sideways, and backwards. Nice inhale. As you exhale, you want to squeeze the ball gently and you want to envision your hips coming together and your rib cage coming together. Inhale. Exhale, squeeze the ball, pelvic floor comes up. So you can envision the labia also sliding together. So inhale, exhale, knees come together, labia slide together, hip bones, rib cage cinch together. Inhale, exhale. So this is just really about reestablishing your breath and your connection to the pelvic floor and your transverse abdominis. Repeat this about 20 times. You just want to make sure you are not breath holding or bearing down. If you feel like you're pushing downwards or if you feel like you're coning at all, you are doing it improperly, and just seek some advice before continuing. From here, you can keep the ball in between your knees. You can prop your head up with your hand. Inhale. Exhale, squeeze the ball. Try and bring rib cage, hips, labia together. So you're doing the same thing, just in a different position. You're gonna do about 10 on this side, and then you'll switch to the opposite side. For the next exercises, you can drop down. You're going to rotate your back flat towards the floor or your mat. You're gonna rotate your hips all the way up, and you're just gonna find the center position. So not totally flat, not totally arched, just right in the middle. That's called neutral spine. From here, you're just going to inhale, and as you exhale, you're gonna set your core. You're gonna march your left leg up. You're gonna march, aim to do about 10 on each side, and then switch to the opposite side. Then you can try doing some alternating. The point of this exercise is you don't want to feel too much rocking in your hips as you're lifting, right? So you don't want to get that rocking movement. You really want your hips to stay stable, your core to stay stable in your back, and you really want just your thigh to be doing the work. Okay, from here, you can also gently let your leg fall to the side. So nice inhale, exhale, engage the core, let your leg fall out to the side and pull it back in. Inhale, exhale, let your leg come to the side and pull back in. So if you go too far, you might see your whole body tilt up. We don't want to do that. You just want to bring it out right before you feel your opposite hip come up and bring it back in. And you really want to try and keep that opposite hip down as best as you can as you move through this movement. So sometimes even just placing your hand on that hip bone will remind your hip to stay flat and for that side of the core to engage. Okay. From here, you're going to go onto all fours, and you're going to do tabletop core activation. So in this position, you're going to inhale, let your belly, let your scar rest, let your ribs rest, let everything rest. Inhale, exhale, you're gonna curl your toes, pull up, inhale back down. If this seems too advanced, just start with the breathing here. So inhale, exhale, pull your belly up to your spine. Do about 10 of those. Inhale, exhale, pull your belly up to your spine. And then if you feel confident, you can try coming up onto your knees. Again, you just want to make sure you're not doing any coning. So I would start with just doing the breathing with the core activation before moving on to the lift of the legs. Next one, you're going to come onto your side. You can ditch your pillow now. And you're going to perform some leg lifts. So keep yourself propped up, core is engaged. You're gonna raise up. You're gonna do 15 lifts here. You're gonna come forward 15 times and then backwards 15 times. And then to start some scar mobility. What you'll do is you'll find your scar. You can rest with your legs flat. And you want to work 2 inches below your scar, so just doing some sweeping movements. You can use some nice oil, argan oil, rosehip oil, coconut oil, olive oil. Then you're going to do 2 inches above the scar. Just going to do some nice circular motions around the scar. Then you're going to go gently onto the scar with one fingertip, and you're going to go along the length of the scar. Just go back and forth lightly. Then you're going to go against the grain of the scar, so you're going to go perpendicular. And then you're going to take 2 fingers and you're going to go up and down the scar, kind of gently stretching the length of the scar. You want to do that for about 5 minutes in the morning and 5 minutes at night whenever you get a little rest. And then again, if there's any spots that aren't healed, you're not to start any of this. As long as everything is healed in the incision site, your doctor has cleared that it's not infected and that you're good to go from that standpoint, you can engage in these exercises under the guidance of a PT.